Some recent studies have shown that perineal massage while pregnant helps to reduce the incidence of both episiotomy and tearing during childbirth. A separate study showed that, especially in the population of women who are pregnant at 35 and beyond, perineal massage during pregnancy helps to reduce the trauma to the perineum when giving birth. Perineal massage using the intimate rose wand makes it easier. The wand can be used to mobilize the tissue from the vaginal opening down through the anus by gently placing this hook of the intimate rose wand and gently applying pressure downward from 3 o'clock, if this vaginal opening were a clock, all the way over to 9 o'clock. And then bonus, after you give birth, the vibrating pelvic floor massage tool can be used to help reduce any tension and prepare your body to get back to the things that you want to do again.